into the room with my mask on. I'm going to be performing hand hygiene for 20 seconds. Hi, I'm Christian. I'll be your nurse for today. Can I have your name and date of birth? Anna Louis Dulles, and your birthday is June 11, 1998. Okay, just give me one moment. Alright, everything matches on your wristband. Do you have any allergies I should be aware of, such as iodine or chlorhexidine? Okay, and have you been experiencing any pain or discomfort recently? Some discomfort because of the urinary retention. Alright. Well, your doctor has ordered a urinary catheter to be placed for you because of your trouble and your discomfort urinating. Have you had this procedure done before? No? Well, I'm happy to explain. So first I'll be lifting up your gown to clean your perineal area. Then I will insert the catheter into your urethra and then into your bladder. From there, I will inflate the balloon attached alongside the tubing so that it remains in place in your bladder and you're able to move around freely. If you feel any discomfort during this portion of the procedure, feel free to let me know. Then I will finish off the procedure by attaching the catheter to a stabilization device on your upper thigh. Do you have any, so that when you get up, it doesn't move around. The urinary catheter will remove your urine from the bladder and drain into a drainage bag at the bottom of your bed. Do you have any questions or concerns before I begin? Okay, perfect. I'm just going to place this extra blanket on you so that you feel more comfortable when I lift up your gown. I'm going to be performing hand hygiene for 20 seconds. Just give me one moment as I clean my table. I'm going to be wiping down my table for 30 seconds and letting it air dry for 2 minutes. How's your day been, Mrs. Dulles? Oh, you're excited for your pregnancy? That's good to hear. Yeah, becoming a parent is a very life-changing experience, but I'd like to also believe it's very rewarding. So I'm excited for you as well. Alright, I'm also going to make sure to clean around the edges of the table. Okay. Going to be performing hand hygiene for 20 seconds. For this procedure, you will need to be laying down or in supine position, which you already are. So I'm going to close your door and close your curtain to maintain your privacy. I'm going to be performing hand hygiene for 20 seconds. As my table is dry for 2 minutes, I'm going to bring over my supplies. I have my 10 milliliter syringe, my alcohol prep pad, my stabilization device, and a few set of sterile gloves, and my Foley catheter kit. Alright, going to be performing hand hygiene for 20 seconds. So now I'm just going to bring your gown down so that I can remove your gown to clean your perineal area. I'm going to put your legs into a frog-like position. You're required to stay in this position till I am complete with the procedure. I'm going to lift up your gown for just one moment. I'm going to make sure to clean the sides. And then clean the middle as well. Alright, I'm going to bring your gown back down. performing hand hygiene for 20 seconds and then opening up my kit. Okay, going to be performing hand hygiene, 20 seconds. Let me dispose of these. And then I'm going to perform hand hygiene for 20 seconds. And lift up your gown once again. Going to perform hand hygiene. And then I'm going to place the sterile drape across in between your legs. Perfect. Now I'm going to drop in my supplies. Alright, I'm going to put on the sterile gloves now. Make sure to fix the glove and then fix the cuffs as well. Let me remove the specimen cup and open it just a bit. Alright, I'm going to now place my supplies between your legs. And then I just need to clean your labia one more time. I apologize, it may feel a bit cold. Then one down the middle. Okay. I'm now about to insert the catheter. I want you to take a deep breath in, and then I'm going to insert it on the count of 3. So 1, 2, 3. I see some urine, so I'm going to advance it 1 to 2 more inches. And I'm going to inflate the balloon. And then I'm going to just pull it back. And I feel some resistance, so now it's secure in your bladder. How was that, Mrs. Idalis? Any pain or discomfort? Okay, perfect. So now I'm just going to collect a sample of urine. Going to scrub the port for 15 seconds. Making sure to let it air dry for 15 seconds as well. I'm going to make sure to draw at least 5 milliliters of urine. Okay, I have my sample. And then the last thing I'm going to do is prep your upper thigh so I can place the stat lock or the stabilization device. I'm going to put the drainage bag on an immovable portion of your bed and then put it at the bottom so that gravity helps drain the urine. Alright, how was that? Any pain? Okay, perfect. I'm just going to put your gown back on. I can dispose of my supplies. Going to place your legs back into position and then put your blanket back on. Remove my gloves. Perform hand hygiene for 20 seconds. Alright, now I'm just going to pour this urine into the specimen cup. I'm going to make sure not to touch the cup or have any splashes. Perfect. And now I'm going to label it with the patient's name, the medical record number, the date and time of the procedure, and this will be sent to the lab. Then I'm going to dispose of the rest of my supplies. Alright, do you have any questions or concerns before I leave, Mrs. Idalis? Okay, perfect. So I'm just going to make sure that 2 to 3 side rows are up, our call bell is within reach. I'm going to sit you back up, and your bed is in the lowest position. Feel free to call me if you have any questions. I'm going to perform hand hygiene one more time before I leave the room. And I'm going to document the date and time of the procedure, the patient tolerated the procedure, the catheter size used was 16, and the urine, there was 400 milliliters of urine observed, clear and yellow. Thank you.